Today we are going to talk about chocolate toxicosis in dogs, and why this is more than just a dog eating something sweet. The toxic problem is mainly the methylxanthines in chocolate, especially theobromine and caffeine. Dark chocolate, baking chocolate, and cocoa powder are the most dangerous because they contain the highest methylxanthine concentration. After absorption, theobromine and caffeine are processed by hepatic cytochrome P450 metabolism, but dogs clear theobromine slowly, so the stimulant effect can last much longer than people expect. Some of it can also undergo enterohepatic recirculation, which is why signs can persist and why activated charcoal may be useful in more serious cases. The pathophysiology is basically loss of the body's normal brakes. Methylxanthines antagonize adenosine receptors, so the calming signal on the CNS and heart is blocked. They can also inhibit phosphodiesterase, increasing cyclic AMP, which amplifies catecholamine effects like epinephrine and norepinephrine. That is why these dogs can progress from vomiting, diarrhea, thirst, and restlessness to hyperactivity, tremors, seizures, tachycardia, hypertension, hyperthermia, and arrhythmias. Treatment depends on the type of chocolate, the dose, the time since ingestion, and whether the dog is already symptomatic. If the dog is stable and the ingestion was recent, emesis with apomorphine or ropinrole can help remove chocolate before more methylxanthine is absorbed. Activated charcoal may be used for larger exposures, especially because theobromine can recirculate. For fluids, these dogs usually receive 4 isotonic crystalloids such as lactated Ringer's solution, plasmolite A, normosolar, or 0.9% sodium chloride, depending on hydration status, electrolytes, vomiting, and acid-base concerns. The goal is to correct dehydration, support perfusion, and promote urinary excretion of methylxanthines. From there, treatment is about controlling the organs being overstimulated. Maropitant is an antiemetic and neurokinin 1 receptor antagonist. It works by blocking substance P, one of the main vomiting signals in the emetic center, so it helps control vomiting. Ondansetron is also an antiemetic, but it is a serotonin 5-HT3 receptor antagonist. It blocks serotonin-mediated vomiting signals in the chemoreceptor trigger zone and GI tract, which can help reduce nausea and vomiting. If the dog develops tremors, methocarbamol can be used as a centrally acting muscle relaxant to reduce skeletal muscle activity. If seizures occur, diazepam may be used because it is a benzodiazepine anticonvulsant and sedative. It enhances GABA activity, which increases inhibitory signaling in the brain and helps quiet the overstimulated CNS. ECG monitoring matters because tachyarrhythmias can become fatal, and drugs like propranolol, esmolol, or lidocaine may be chosen depending on the rhythm. The big takeaway is that chocolate toxicosis is a dose-dependent methylxanthine emergency. The dog is not just acting hyper, the CNS and cardiovascular system are being chemically overstimulated, so treatment is about stopping absorption, supporting elimination, and controlling seizures, heat, and arrhythmias before they become life-threatening.